Going to start by washing my hands, provide for privacy, and raise the bed up to an appropriate level to work at. Hi, my name is Ian Bruce. I'm going to be your nurse today. Before we get started, can you tell me your name and your date of birth?
Samantha Ober, May 15, 1993.
Thank you, Samantha. Well, today I'm going to do what's called the head-to-toe assessment. Just going to ask you some questions, look at you, listen to you. Does that sound good?
Yes.
To start off, do you have any pain today?
No pain.
And on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain imaginable, how would you rate your pain?
0.
How about sleep? How much sleep did you get last night?
8 hours.
8 hours. And do you get that much sleep normally?
Yes.
Okay. And do you feel rested after getting that much sleep?
Yes.
How do you feel today?
Good.
Good? Good. Do you feel like you have a good social support system?
Yes.
Okay. I'm going to ask you some questions that might seem a little bit silly. Do you know where you are right now?
The doctor's office.
Okay. And can you tell me your first and last name?
Samantha Ober.
And what is today's date?
June 16th, 2020.
And times 3. All right. I'm going to go ahead and look at your face. To start off, I'm going to have you look at my nose while I shine a light in your eyes, okay? Okay, and then go ahead and look at my pen. Pupils equal, react to light, accommodation noted. Go ahead and open your mouth and say ah for me. Mucosa are pink and moist. And go ahead and swallow. No issues with swallowing. Give me a smile. Nice. No facial droop noted. Symmetry of eyes, mouth, and ears. Next, I'm going to listen to your heart and your lungs. But before I get started, have you had any sort of cough?
No.
Shortness of breath or difficulty breathing? Any infections like a cold or a pneumonia? Okay. And have you had any chest tightness or pain?
No.
All right. Well, I'm going to have you go ahead and sit at the edge of the bed for me for demonstration purposes. I'm going to listen to your lungs. Every time I place the stethoscope, just go ahead and take a deep breath into your mouth and then out. If you feel short, dizzy, or have shortness of breath, just let me know. Lift your shirt up a little bit. Good. One more time. One more time. Good. Next, I'm going to listen to your heart. I'm going to start with the aortic valve, left intercostal space, right of the sternum. Just go ahead and breathe normally. Next, I'm going to listen to the palmatic valve, left intercostal space, or second intercostal space, left of the sternum, excuse me. And then I'm going to listen to the apex of our heart and the mitral valve, which is the fifth intercostal space at the midclavicular line. S1 and S2 identified, regular rate and rhythm, no abnormal sounds noted. Next, I'm going to listen to your lungs on your back, through your back. So again, same thing, if you need a break, let me know. And then lift your shirt up again. Thank you. You can go ahead and lay back down. Lungs cleared, auscultation anterior and posteriorly. Symmetrical breast, equal unlabored bilaterally. How's your diet?
Balanced.
Balanced? Okay, do you have like a balanced amount of carbs, proteins, and fats?
Yes.
And how does your body tolerate that diet?
Good.
When was your last bowel movement?
Today.
Today? And how would you describe that bowel movement?
Normal.
Nothing abnormal, no diarrhea or... Okay. And how often do you normally have a bowel movement?
Once a day.
And what about urination? Have you noticed anything abnormal?
Nope.
Any burning sensation?
Nope.
How about foul smell in urine? Have you noticed any vaginal discharge or bleeding?
No.
No. Okay, good. Well, I'm going to go ahead and have you lift up your shirt, and I'm going to look at our abdomen, and then I'm going to auscultate it and then palpate it. Abdomen is white, soft, round. I'm going to listen to activity. All 4 quadrants are active. Next, I'm going to palpate it. If you have any pain or tenderness, just let me know, okay? Anything? Great. You can go ahead and lay your shirt back down now. Thank you. Go ahead and sit at the edge of the bed for me. I'm going to assess your skin now. So first I'm going to start with turgor. Quick rebound. Alright, I'm going to feel your arms using the back of my hands. A little bit cool, but mostly warm and dry to the touch. I'm going to check your capillary refill on both hands. Less than 3 seconds, quick refill. I'm going to check your radial pulse. Okay. Next, I'm going to have you go ahead and grip these fingers with your hands as hard as you can. Very good, thank you. Equally strong finger or hand grip strength. 2+ radial pulse. I notice you have some tattoos. Do you have any piercings?
All my ears are pierced.
Okay, and do you have any wounds or bruises?
No.
Have you had surgery recently?
No.
So no incision sites or, okay. Next, I'm going to go ahead and check your legs. I'm again going to scan your legs. Same thing, warm, a little bit cool on some sides, but dry. No edema noted. I'm going to check your Dorsalis pedis pulses now. Very good. I'm going to check your capillary refill. Less than 3 seconds again, 2+ for Dorsalis pedis pulses. I'm going to test your foot pushes and pulls. Go ahead and push against my hands and pull. Very good. Equally strong bilateral foot pushes and pulls. Do you use any sort of assistive walking devices?
No.
All right, well, if you're feeling able, go ahead and stand up, walk towards the TV, and then walk back. Equal gait, unlabored, no issues walking. Well, that concludes my head-to-toe assessment. So if there's anything else you need, I'm going to go ahead and notify your healthcare provider. Again, my name is Ian Bruce. If you need anything else, just let me know. I'll wash my hands and exit.